Hello everyone, welcome back to our channel. I am Dr. Surinder Sharma. Today we are talking about a serious global health issue, Mpox. The emergence of a new strain with more efficient human-to-human transmission and serious disease has raised global concerns. The WHO has declared Mpox a public health emergency of international concern. In this video, we will cover what Mpox is, how it spreads, symptoms, treatments, and whether you should be worried. We will also share steps to protect yourself and your loved ones. Mpox is a viral disease caused by Mpox virus. It is in the same family as the smallpox virus. However, Mpox is milder in symptoms, severity, and mortality. Mpox was first observed in monkeys, so it was called monkeypox. But it actually spreads from rodents to humans. To avoid confusion and stigma, WHO renamed it Mpox in November 2022. Historically, Mpox was limited to Central and West Africa, but now cases are reported worldwide, including in India. Symptoms of Mpox appear 5 to 21 days after transmission. Early symptoms include fever, headache, chills, muscle aches, back pain, and swollen lymph nodes. After the fever, an itchy, painful rash develops, starting on the face and spreading to the body. This includes the palms, soles, groin, and genital anal regions. The rash can range from a few sores to thousands. Sometimes lesions appear in the mouth, throat, or eyes. The rash progresses through stages: flat rash, raised bumps, fluid-filled blisters, pus-filled blisters, and scabs. Symptoms last for 2 to 4 weeks. However, most people recover fully without complications. Mpox usually does not leave permanent scars unless lesions are scratched or infected. Mpox is usually mild and self-limiting, meaning it resolves on its own without lasting harm. Severe complications are rare but can include infections, respiratory distress, or encephalitis. Vulnerable groups like children, pregnant women, and immunocompromised individuals are at higher risk. Mortality rate is 1 to 3% depending on the strain. There is no specific treatment for Mpox, but symptoms can be managed with supportive care, which includes plenty of fluids to stay hydrated, antipyretics, antihistamines, topical creams, and pain relievers to manage fever, pain, and itching. No antiviral medication has proven effective against Mpox, but tacovirimat shows promise and may be used in special cases. Most patients recover with supportive care. Someone with Mpox should be isolated until all skin lesions have healed completely. After recovery, sexual intercourse is to be avoided for 3 months as the virus can remain in semen for a long time. Mpox spreads through close contact. Person-to-person spread occurs through contact with body fluids, respiratory droplets, skin lesions, contaminated objects like clothes or bedding. Animal to human spread happens through contact with infected animals, particularly rodents, through bites and scratches, or by consuming poorly cooked meat. To prevent Mpox, avoid close contact with strangers and people with symptoms, especially those with rashes. Maintain good hygiene, wash hands frequently, or use hand sanitizer. Avoid handling animals, especially rodents and cook meat thoroughly. Clean and disinfect objects and surfaces that might be contaminated. Wear masks and gloves in healthcare settings. A vaccine for Mpox is available. The Jynneos vaccine is approved for Mpox. It requires two doses 28 days apart. Unfortunately, it is in limited supply. ACAM 2000 is another option, but it is approved for use only if Jynneos is not available. WHO recommends vaccination only for high-risk groups, not for the general population. High-risk groups include healthcare workers, lab personnel handling these viruses, and those in close contact with confirmed cases. If exposed to Mpox, getting the vaccine within 4 days can prevent the disease or reduce its severity. Mass vaccination is not necessary at this time. Requirements and recommendations may change if the virus evolves or new information emerges. So far, no medication, including tacrolimus, has shown a preventive effect. There are two main types or genetic variants of Mpox virus, Clade 1 and Clade 2. Clade 1 has two subtypes, 1A and 1B. 1A is endemic in Central Africa and spreads mainly from animals to humans with limited human-to-human transmission. 1B is a newer strain with efficient human-to-human transmission, which is concerning. It has caused outbreaks in nearby countries. This strain may be more severe with a high mortality rate of about 3%. That is why this is cause of recent global alarm. Clade 2 also has two subtypes, 2A and 2B. 2A is endemic in West Africa with low mortality. 2B is a newer strain responsible for the global outbreak in 2022, primarily affecting gay men through sexual contact. It is milder with a mortality rate of less than 1%. Now, let us address the million-dollar question. Could Mpox become as serious as COVID-19? The answer is, it is highly unlikely. Mpox does not spread as easily as COVID-19, which is highly contagious and spreads easily through aerosols even from a distance. Mpox primarily spreads through close contact with an infected person's body fluids via skin contact, kissing, talking in close proximity, sexual intercourse, or handling objects touched by the infected person. Therefore, simple public health measures such as early case identification, isolation, avoiding close contact with infected individuals, and maintaining good hygiene can effectively control Mpox. We will keep you updated with new information as it becomes available. In the meantime, if Mpox is suspected, isolate, consult a doctor, and follow government guidelines. That is all for today. Thank you for watching. If you have any doubts or suggestions, please write them in the comments. If you found this video useful, please like, share, and subscribe to our channel. See you soon with a new video. Stay happy, stay healthy.